What's going on YouTube? It's Marciano, your vet tech, back with another helpful vet tech video. Today we're talking about limping dogs and why your dog might be limping. If you have a young, healthy, athletic dog, this might be confusing, and we're going to go into it today, so stay tuned. Stay tuned. Okay, we're back. So today we're talking about torn ACLs or anterior cruciate ligaments in dogs' knees. So they're also called stifles. So anyone's thinking, okay, don't four-legged animals have four knees to begin with? Well, kinda, sorta. So the anatomy is still referred to like the front legs have elbows, the back legs have knees, but in dogs we call them stifles. So we're gonna go into why is your dog limping. So we're just gonna do like a pretend case study here. We got a young, healthy, we'll just say pit bull terrier coming in limping after playing ball with its owner, and it's barely weight bearing on the leg. So it's one of the back legs, and not really any swelling showing up. So we're gonna put up a couple x-rays. So this is an x-ray of a normal dog stifle or knee. So we're gonna put that up, and this is a stifle that's damaged. So a way to find out if a dog has a torn ACL, so anterior cruciate ligament. We also have these ligaments, and soccer players tear them all the time. So a lot of times when a dog jumps and like tweaks itself or turns while it lands or something, or lands in a hole or something, and causes the knee to bend in an awkward angle, it could snap or rupture one of these ligaments. And we're going to show you the anatomy right now.
The knee is a fairly complicated joint. It consists of the femur above, the tibia below, the kneecap or patella in front, the bean-like flabella behind. Chunks of cartilage called the medial and lateral menisci fit between the femur and the tibia like cushions. An assortment of ligaments holds everything together, allowing the knee to bend the way it should and keep it from bending the way it shouldn't.
So this is a normal stifle here. So there's a model here, and then if we bend this back, you can see the ligaments that I'm talking about right in the middle, so that it holds the knee together. Here's a rear view. So right here you're looking at, it's also called the cranial ligament of the knee, or anterior cruciate ligament, and then posterior cruciate ligament on that side. So that's what keeps the knee from bending the wrong way, along with the patella right here, kneecap that slides along the femur here. So you have the femur here, which is like the thigh bone in us, and then you have the tibia here, which is the lower leg bone. Showing you once arthritis starts to set in. So say they rupture that ligament there, they can start putting strain on the femur, because these two bones are going to put pressure on each other. The femur and the tibia are going to start to touch because the anterior cruciate ligament is ruptured, and it's going to cause inflammation every time it lands on that with its weight. It's going to cause pain. This is moderate arthritis setting in here. See how red damage that joint is getting right in the back there. We're going to some advanced here, so you can see a lot of vasculature forming there, and this is starting to get damaged. The bone is starting to overgrow, and you can see a lot of pressure is put on that joint. You can see that's getting damaged where the meniscus would be, which is the padding between these two bones. It's padding that we have between our lower leg bones as well. You can get what's called a drawer sign when they really have a rupture in the anterior cruciate ligament. And so what that means, basically, also put a little graphic up, is this femur, when you have them unconscious, of course, this femur and the lower leg bone, the tibia, will slide back and forth. So this won't won't really feel stable. And that's how you know you have a ruptured anterior cruciate ligament. So what does that mean, anterior cruciate ligament rupture, and what does that mean to a dog's pain, and what does it mean for their life? So what can happen is they're going to have a lot of pain from it, that inflammation from that ligament constantly getting inflamed from the upper leg bone. So the femur constantly landing on the tibia can cause inflammation in the middle of the knee and cause a lot of pain. So that can cause severe arthritis to set in later. So what a surgeon will do is, orthopedic surgeon in veterinary medicine will do is basically clean out that ligament that's damaged and replace it with an artificial anterior cruciate ligament. So basically it's like very thick fishing line, which you would see kind of a similar material. And they'll do a few things to stabilize the joint. And when you remove that ligament, it'll keep it from inflaming, causing further pain. And the surgeon can evaluate whether the meniscus, which is the padding in between the bones of the leg, of the knee, are stabilized and basically not causing any damage. If there is damage there, they will remove that padding, either replace it with the artificial meniscus. They heal pretty rapidly. A lot of times after the surgery, they're able to walk pretty much immediately, but we're still going to confine them. And you don't want to like really run the dog, have them jumping in and out of the car, things like that. You want to give them a good 6 to 12 weeks even to fully heal. To help recovery, glucosamine supplements, castrochondroitin to help basically build cartilage up, or keep what cartilage they do have healthy. TAA surgery. So what's a TAA surgery? It's also, that's short for tibial tuberosity advancement. So that's a type of technique. We're not going to get into details of how that's done, but if this is basically a technique in repairing this type of injury. The other surgery is a TPLO. This is another procedure. The other procedure is known as a tibial. The other procedure is known as a tibial tuberosity. The other procedure is known as a tibial tuberosity. The other procedure is known as a tibial plateau. The other procedure is known as a tibial. Procedure is known as a tibial plateau leveling osteotomy. The idea of this procedure is to basically change how the weight of the femur is bared on the plateau of the tibia, which is the flat part of the top of the bone. So I'll show you on the model, which is this part right here. So that flat part on top of there, so plateau right there. The other procedure is known as a tibial tuberosity. The other procedure is known as a tibial tuberosity. The other procedure is known as a tibial tuberosity. The other procedure is known as a tibial tuberosity. The other procedure is known as a tibial tuberosity advancement surgery. So this surgery basically is they're going to change the angle of the tibia probably around this area, which is the posterior area of the tibia there, so right here. And the idea is to change the angle of basically the way the pressure is put on the patella ligament here. So that's going to change the way the weight is bared on that joint. So it's kind of a different method, but same idea where you change the angle and the biomechanics is doing the weight bearing. So your dog's limping. Is it worth it to even get either one of these surgeries done on repairing the stifle? And I would say yes, because it's going to take away pain. Your dog's going to be a lot happier, and it's not going to have arthritis build up in that leg, at least not as fast. And the arthritis that does build up is going to be minor compared to if you didn't get the surgery done. Especially with a very heavy breed, a large breed dog like a Mastiff breed, Dane, things like that. You want to make sure those dogs have this surgery done if they have a damaged stifle, because you don't want them to have a lot of pain. You don't want them to be miserable for the rest of their life, and just do right by the dog. A lot of times I will recommend to owners that have large breed dogs is insurance, and hopefully the insurance that you do pick has orthopedic surgery listed in there. Usually if you get a puppy on a plan and they do their wellness exams and everything through the insurance, 9 times out of 10 they'll have something like surgery repair on an injury. So they'll usually repair one knee, but they won't repair the other one later. So you have to check with your insurance and see what's best. One of the important things to know when a large breed dog ruptures its cruciate ligament is the leg on the opposite side, the good leg, is potentially going to go bad within a year's time. The reason for that is they put a lot of weight and pressure on that ligament, so it creates a lot of damage in the good leg. So that's pretty bad, and you pretty much can expect another surgery on a very large breed dog within a year. So start saving up. One more thing, wanted to pop in and kind of drop some knowledge on dog breeds that could be susceptible to this if you're looking into getting puppies. So I have a list here: Rottweiler, Golden Retriever, or Rottweiler, Golden Retriever, Neapolitan Mastiff, Newfoundland, Akita, Saint Bernard, Chesapeake Bay Retriever, American Staffordshire Terrier, or American Pit Bull Terrier. So that's just a little insight on dogs that could be susceptible to damaging their ACL. Alright, later guys. Oh yeah, don't forget to comment, like, and subscribe. Peace.